everybody. So I've got my lovely patient Emma here. We're going to do some treatments on her face today. So the plan today is to treat the upper three facial areas with Botox. Botox, as you know, is a toxin that paralyzes groups of muscles so that you can get reduction in static and dynamic wrinkles and create effects such as mild degree of brow lifting. So we'll do that today. And also we're going to inject some fillers in Emma's cheek just to enhance her mid-face. It will give her high cheekbones, a kind of a chisel look, which she already has. So the idea is to enhance that. And overall it will make her look slimmer. So let's see how we get on. So the first thing I do generally is to mark the groups of muscles where I am going to inject. I don't always do this, but for demonstration purposes, let's do that. So Emma, if you can close your eyes as tight as you can. So the muscles that produce these frown lines are called brow depressors, and they create these frown lines and the transverse crease here, and we can easily relax that with Botox. These wrinkles on the side of the eyes are called crow's feet, and they're caused by a group of muscles called the orbicularis muscle. So these are the two groups of muscles. The last group of muscles would be that creates the transverse lines on the forehead. So Emma, look up for me as hard as you can. So Emma's actually not that bad, but we will still relax these lines that you see, and without freezing her completely, so she'll have some expression left, which makes it look more natural. So the next stage is very quickly I'm going to draw the area I'm going to inject the cheek with. So generally I use the upper ear and the corner of the lip as my guide, and the outer eyebrow is also my guide, and usually that corresponds to a few points on the bone here, which I call the zygomatic arch. So once these areas are marked, then I'll go ahead and inject these areas. And what this does, it just lifts the cheek up a little bit, gives a cut chisel look and a high cheekbone look, and also sometimes it improves the angle of the eye as it lifts the skin up. So same thing with the other side. Corner of the mouth, upper of the ear, to draw a reference point, and just feel the zygomatic arch. And what I'm feeling for are the ligamentous attachments from the zygomatic arch to the skin, and the aim here is to lift those ligaments by injecting deep onto bone to create the desired effect. Okay, super. So the next stage is Botox injection. So different people have different ways of reducing the pain from the needles, from anesthetics. Some people use Emla cream. I tend to use ice because in my hand certainly it reduces the comfort associated with Botox. But you know, different ways, they're all pretty good, depends on what a surgeon's comfortable with. Okay, so we use ice in this case. You ready, Emma?
Yes.
Okay, so sharp scratch coming now. So these groups of muscles are called brow depressors, or the corrugators, and by injecting Botox into them, you not only get rid of the frown lines, but it also lifts the brow upwards, which is of course aesthetically desirable. Sharp scratch now. So that's what I'm doing. I'm just targeting Emma's corrugator muscles, and if you're in the right spot, then there usually is no bleeding or bruising from Botox injections. It is of course an office-based procedure. It takes about 4 or 5 days to start to work, and by 10 days it should have done the business, and it usually lasts for about 3 to 4 months depending on what product is being used. So I've treated one facial area totally. I'm going to treat the forehead next, and then lastly the crow feet area. I'm just going to now focus on our eyes. As you can see, there's hardly any bleeding, and these red dots go away in an hour or so. So as with anything else in life, in the right hands everything is safe and predictable and reproducible. So that's what we aim to achieve here with these treatments. Okay, ready, Emma, for the next one? So the whole process generally doesn't take more than 5 minutes. Um, but of course, with Botox injections, things can also go wrong if injected into the wrong place. The more common one is if it's injected too close to the brow, it can cause brow ptosis, and that's obviously not a desirable effect. And if you want your patients to follow you and be with you, so best to avoid it. Okay, so that's Botox finished. So we're going to move on to fillers now. I'll inject some fillers onto her cheek on either side. And usually, depending on which area fillers are being injected, they have local anesthetic in them, so it's not generally a very painful procedure. There are a few areas in the face, such as lips, which are quite sensitive, so fillers in that area can be quite uncomfortable. But in this area, usually it's not bad at all. How are you doing, Emma?
Good, great.
What do you think about Botox so far?
I love it.
So,
and it's not painful at all.
So it's not the first time Emma's having Botox, so she's very well aware of what to expect, and she appears so relaxed. Okay, so we're going to do part 2 now. After the Botox injections, I'm going to inject some fillers into her lateral cheek in an attempt to lift the cheek up and essentially rejuvenate the midface in a subtle fashion, which should last for about a year and a year and a half usually. So, you ready, Emma?
Mm-hmm.
Sharp scratch now. Okay, so needle touches bone in this case, so these are deep fillers. And I usually inject very slowly, so I know how much product I'm injecting. So it's done in a controlled fashion. I think that's quite important. So once the injection's in, I'm going to gently just mold the filler a little bit in, and in the process, just have a little bit of tension on the face upwards, because it allows the filler to settle in the right location and to have the desired effect. Okay. So I'm going to finish treating this side, so then we can maybe have a comparison of the treated to the untreated side. Just okay. Second injection coming now. So sometimes patients say they hear a crunching sound as the filler is going in, hitting bone. Is that true, Emma? Do you feel?
Yes, I can hear it.
You can hear it almost, yeah.
Slightly.
Okay, so we're getting there. So 2 injections are in. Again, same procedure will be repeated about molding the area and pulling the face up in the process for about 30 seconds. Change the needle. Quickly. Should be prepared. I'll have to edit that. Okay, last injection on this side, and then we'll do the comparison. So what I'm feeling for the bony landmark where I want to be when I inject this filler. Okay, and the sharp scratch coming now. That's it. Okay, so Goldsby. So now after 10 seconds or so, we can compare the treated side to the untreated side. We'll ask Emma to sit up a little bit so we can appreciate any differences, if there are, I hope, both sides. so we're just going to continue with the other side. Sharp scratch now. That's it. All done. Just molding the filler into place. Okay, second injection coming up. Sharp scratch now. That's it. Sometimes when I've treated both sides, and if I find one side needs a little bit more, I can always go back and do a bit more on the other side. So, and that's absolutely fine. Last injection coming up now. Okay, sharp scratch coming now. That's it. Okay. Okay, so I'm just going to have a look. Just bring your head down. So, and then see if the other side, I think this side looks nicer, so I'm going to inject a little bit more on this side, just to have this sort of effect. I think this looks really great. So, Janine will okay, back down. Sharp scratch coming down. Okay. So the very important thing about fillers, injections to the face is I think it's extremely important to appreciate and understand the detailed facial anatomy in order to be safe, the anatomy of blood vessels, nerves, muscles, and where the important structures are, so we can avoid them while injecting fillers and be in the right place, and I think that's extremely important. Fillers are considered as injectable implants, so they have to be injected by experienced qualified practitioners who are licensed to do so. I think I'm a firm proponent of that. I think knowing facial anatomy is the key with these things. Okay, so I think we've injected just over one syringe in both sides of the cheek, and as you can see, the filler injections are actually gone very lateral to the cheek. I think this is a mistake to inject filler in this area because it's a mobile area, and the weight of the filler would make matters worse over time. So, so yeah, Emma, that's all done.
Great.
How do you
Thank
feel?
you. Amazing.
You haven't even seen yourself.
No, I
yet.
know. I just know.
Okay, let's have a look. Just, for me, yeah, I think that's certainly made a big difference. So of course, in this area, I removed some of your makeup, Emma, so there's a twin tone. But I think the key thing with this type of filler is to appreciate kind of a cut chisel look, you know, slightly high cheekbones, and a slightly lifted look in the mid face, and the depression under the arch, which is quite aesthetically pleasing, it enhances the so-called Augie curve and so on. Okay, thank you.